I'm going to give an overview of the work that we've done in the WorldPop team, but also the wider collaborations in Grid3, Countdown, UNFPA, and many other partners. So first of all, that's the question, why do we need population data? I guess most of you know the reasons. If you're thinking about the kind of questions we may be tackling in the global development field, is it a major outbreak? What's our denominator? Do we have a workforce to address it? Where is our target demographic group? How to target surveillance campaigns to reach those groups? If we're running a vaccination campaign, how much vaccine do we actually need? Where do we need it? How should we plan our delivery? And then a disaster, how many people are affected by this disaster? Where should we deliver aid? There are many, many other questions and uses of population data in government, but the challenge we face is often this kind of situation. So this is the situation in 2020. If we're using census data as our basis, done every 10 years, there are many countries back in 2020 and still today that haven't done a census in the latest round. And it's not just the challenge of having a recent census, but even with a recent census, populations can change fast. There are spatially varying fertility and mortality rates that make small area projections difficult to do over the time periods between census years. There's displacement and migration going on that are changing those populations all the time. And then when we do have reliable recent data, sometimes the data that we're working with can be like this, matched to administrative boundaries, but maybe 100,000 or more people in each one of those units, and we don't really know where those people are to be able to do targeting of resources, more fine-scale planning. What ideally we'd like is perhaps something like this, gridded population estimates that really show those distributions of the populations within those administrative units. It may look like this close up, and gridded data sets are producing an estimate, maybe with uncertainty measures as well, for each one of those 100 by 100 meter grid squares. And ideally, some measure of how those populations break down by male, female, age groups, and over time. The value of having these gridded data are many and varied. We can then aggregate those data to different decision-making units, whether those are administrative, they may be health units, they may be enumeration areas for planning for the next census or planning a survey. They could be numbers of people by settlement. We can delineate settlements from satellite imagery, estimate those populations within those, like adding up those grid cells. We can look at the integration with other types of data. So where are health facilities and how many people are living within 5 kilometers of a health facility? And then we can start to integrate those to answer questions like identifying where vulnerable populations are in relation to vaccination centers. Here showing those estimated populations over 65 years of age that are within areas that are settled, and then adding in here travel times to settlements, health facilities, and population data sets to understand what's the travel time to vaccination centers. And then highlighting those areas that are a long way from those vaccination sites to try and target resources and increase coverage. And broadly, the kind of approaches that have been used to produce these types of gridded data sets involve 3 main ingredients: demographic population data, some count of population, settlement data that can often come from satellite imagery to define where are the people living and where they're not, and then some form of geospatial data that tell us within those settlements and across the country, how do those population densities vary within settlements, within region. And it's a statistical model that brings those together to understand the relationships, to look at where we have data, how do those settlement and geospatial data sets vary, and can we then use the geospatial data to predict population numbers grid cell by grid cell, ideally with uncertainty. This looks like we have a solution that works everywhere. We have a model that we can just apply everywhere. Unfortunately, it's often not the solution that it's that simple. There can be a wide range of demographic data sets. So why use a 20-year-old census when we have reliable projections or have registry data that we know is more reliable and up to date? What about field teams have gone and collected small area enumeration data from a household survey? We may have a demographic surveillance system. We may have health campaign data, all of which take different shapes and forms. And then there are all types of different models that can sometimes give you a headache reading them. There are not many people in the world who even know what all of these mean, and applying them produces different outputs. And then, to complicate things further, there are all kinds of new geospatial data sets coming, mapping individual building footprints, building heights from satellites, classifying them into neighborhoods, identifying residential and non-residential populations, the changes over time, images of the Earth at night, of land cover, of rates of poverty, of mobility, and mobile phone movements. And often when we're talking to non-technical specialists, this is the kind of result that causes. Multiple different types of demographic data, multiple types of models, multiple geospatial covariates. So what are the kind of overriding questions here? We need to take a step back, think about who needs these data and what do they need it for? And that may be a situation of a National Statistics Office. An example used to support the census process, fill gaps in official statistics, maybe produce inter-censal estimates, or an updated sample frame. And so there are pretty much some basic key needs that ultimately, ideally, those should be based on data that they have collected routinely through a census or surveys. There needs to be ownership of those outputs to be able to understand and explain those methods, to be able to argue them within government and importantly to the public as well. The Ministry of Health may have slightly different uses, denominators for health metrics, targeting interventions, developing microplans, strategic plannings. And so there's a need to integrate with other forms of health data. To be broken down by age and sex groups is important for targeting resources, targeting vaccinations, bed nets, and be able to ideally update those quite regularly as disease and health situations change. And then a third use may be humanitarian response agency, assessing those populations affected by a major impact, major event, targeting aid, monitoring the changes as a situation unfolds. So a need for rapid update, simple outputs, and ability to adapt to often recently collected messy data. So how do we ensure those needs are met? Methods can be understood by those people who are producing those outputs. The data can be accepted by governments and actually used. We don't want them just sitting on a shelf. And this is where, importantly, co-development with those end users of data are pretty vital. This should take place at the very start of any kind of process to understand what are the needs, what data exist to meet those needs. Are there recent survey data? Is there recent census? What skills exist within a Ministry of Health or a National Statistics Office or a local university to design and take forward solutions, and then coming up with plans for co-development, training plans, working together. And all the examples we're going to present here are ones that have started off with some kind of workshop, online meeting that have asked these questions and come up with a plan. And I'll base this to show there are very different types of solutions depending on where we are in the census cycle. So we may have a census where a few years after it, the enumerated totals can be the most accurate. But as time goes on and projections are used, things become increasingly uncertain and there may be need for different types of approaches. And then there can be new forms of data collected and planning for a census until you go back to that process at the start of the census enumeration. But a big question, of course, is when was the last census, which for certain countries can be 20, 30, even 40 years ago. So this first part, the census enumeration, there's often interest from national statistics offices in having small area estimates that match the census counts. Those data that can be available can be at aggregate level, aggregate counts by district, by province. And so this is where top-down disaggregation, to taking those counts at the administrative units, using the more detail from the geospatial data sets in a random forest model, in this case, to estimate those populations at finer spatial scales. And here are 3 examples working with statistics offices in Kenya, Mozambique, Sierra Leone, to produce these gridded estimates from the most recent censuses, producing much finer scale information. There are open training materials, and these, we're getting to a stage now, I think, where there are many statistics offices or ministries of health who can run and update these types of models themselves. The second stage may be this point where we're getting beyond the census data into producing projections Here, we may be in a situation where we have 2015 census. We want to project forward using different types of projection models, whether it's a cohort component, a mathematical one, an economic one, to produce 2022, 2023 estimates, and then disaggregate those to grid squares to produce those small area estimates that can be so useful for different applications. So here are examples of working with the Senegal Statistics Office, their official projections forward to 2020, and then disaggregating those. In Niger, projecting forward from the 2012 census to 2021 and disaggregating those to grid squares. And the situation of Ukraine, the last census was 2001. Here working with the Ukraine Statistics Office and UNFPA to produce common operational data sets based on registry data. But these are only available at province level, so disaggregating those again to grid square scale for use in humanitarian response. And in a situation where there has been lots of displacement, being able to incorporate other forms of data into those projections. So in this case, displacement surveys from UN Organization for Migration. So we have to then disaggregate and also map out the locations of refugee camps to account for those. And then we get to the situation where maybe we don't trust those projections at all. We're a long way from the last census. We don't trust the projections because things have changed so much, and we need a way of estimating populations. And here from the toolbox, we may be working towards something like a bottom-up model where we only have small area enumerations that have been collected recently that we trust. And we want to build a statistical model to estimate populations in the areas that we haven't sampled. And here we can develop types of approaches that adapt to different types of data that may be available. So in this case of Cameroon here, last census was 2005, and projections become very uncertain when we get to 2022, 2023. But recent surveys have been undertaken where they've counted populations. And so gathering together all of that data gives over 2,000 different locations where populations have been counted recently. And so these can be used to produce estimates in a prediction model that provides uncertainty as well. And in each case, in collaboration with the Statistics Office. A situation similarly in Papua New Guinea, where malaria surveys were undertaken and counted populations in those locations, but not across the entire country. So there are gaps here. And again, training a statistical model to predict and estimate those populations in collaboration with the Statistics Office. And a part of the GRID3 program, working with field teams to collect individual areas of microcensus enumeration, to count populations in small areas, use those to train a model and estimate population numbers. In the situation in Democratic Republic of Congo, last census 1984, again, working with field teams to collect training data to predict those population numbers. And again, in each case, there are training materials and collaborations along the way to ensure that there is an understanding and a building up the skills to be able to undertake this kind of modeling and be able to explain it within government and to the public. And then reaching the stage where a new census is about to be undertaken, we may be in a situation where census cartography data is taken. They can be collected as part of the census preparation phase, but can often be incomplete. A lot of value in having full coverage of recent estimated population for the census process. So here we're making use of that incomplete data to predict numbers of people per administrative unit and then disaggregate. So combining different models, another type of tool we can use. As an example from working with the INSTAT in Mali, where census cartography was complete in those light gray areas, but not in the dark gray areas. So again, a model was developed to fill in those gaps. And finally, they're back again to the census enumeration. But some cases, there can be very hard to access regions in that census. Conflict, just difficulty in access. And natural disasters can mean that there are certain areas of a country that cannot be enumerated. So here, a similar type of approach to the census cartography can be undertaken. Here's an example of working with the Burkina Faso last census in 2019, where these areas in grey or in darker green were under enumerated. And here, those areas that could be counted in A were combined with geographical covariates to predict those areas that were not sampled. Those predicted areas were then combined with the full census and used to disaggregate the grid squares in B. And a similar thing in Colombia, where large areas were inaccessible for the 2018 census, and the Statistics Office developed approaches here to estimate those population numbers. So if we can implement these different types of tools, what does this all enable? Some examples here. A gridded population data set, in this case in Benin, has enabled them with a development of a pre-EA tool to identify enumeration areas in planning for their next census, which is being undertaken towards the end of last year. It can be a way to produce official statistics. So the Burkina Faso example formed part of those modeled estimates, formed part of the national statistics. South Sudan has just validated modeled estimates in their parliament to produce new estimates across the country. It can be used as a way of planning and developing infrastructure. So part of the Grid 3 program, engagement with Sierra Leone here, use gridded population datasets to identify demand for schools and populations within catchment areas. They can form part of vaccination microplans here in Nigeria, producing ways of integrating both population data with boundaries, place names, and settlement delineations as part of Grid 3 to estimate those populations in need of vaccination. Similar thing in Democratic Republic of Congo here. Paper maps identifying those areas that are in need of vaccination, used then by field teams to go and deliver those health interventions. These types of data set are feeding now into health information systems. So DHIS2 here has a MAPS component and is undertaking training in this to be able to integrate health facility locations, understand populations living in different areas of aggregation. In health financing, here's an estimation of population for the first time since 1979 in Afghanistan, and we used an analysis to justify extra funding, and an extra 1 million kids are now vaccinated because of this population data. Disaster preparedness, having these data based on official projections and official statistics means more likely acceptance of numbers impacted when a disaster comes along. So this is working with UNFPA to gather together all the official projections and identify those areas at risk of coastal flooding when the hurricane season comes along. And then finally, in disaster response, having these data readily available to overlay with other geospatial data sets like the mapping of flooding enables rapid assessment of populations affected. And a very exciting component of all this that we're seeing happening is the development and use of these types of approaches by highly skilled statistics offices with lots of resources. Then their experts are helping to train other statistics offices who are supporting those with less resources. So here, DANE in Colombia has supported Brazil, and both DANE and Brazil have supported Haiti and plans to support other countries with model population estimates. And of course, we see this type of thing happening as expertise builds across West Africa, data science Nigeria there, training undertaken in Thailand, and hopefully we can build up more of this expertise. So I'll finish here, but hopefully you've highlighted that there's a wide variety of needs. Data in changing situations means that often a one-size-fits-all model is often not the most appropriate. Local ownership, co-development are really important for developing trust in the data. And if we want to see those outputs used by national statistics offices, ministries of health, and developing that expertise regionally and in networks can help move us towards the sustainability to be able to do this. So thank you, and I just acknowledge this is the work of a much wider team and many different initiatives.